Thanks for being here this morning to get an inside and practical look at Civil Health Index. Yesterday, we heard a lot about Civic Health Index as a measurement tool. The intention today with this presentation is really to look at what ends up being the most recent Civic Health Index done in the state of Florida, and it was done right here in St. Pete. It really is the way we know how we're doing around civic health. And for the next 40 minutes or so, we intend to be very practical in terms of how is it that other communities might learn from what happened here in St. Pete, and as they think about whether doing a civic health index makes sense. Hopefully, we'll leave room for questions at the end, or you can ask them in the middle. It doesn't matter. And again, you're going to get there is a PowerPoint presentation about this, and that's going to be available to you. It has much more details than perhaps you'll hear today. We have two people who really were involved in the birth and nurture of the St. Pete Civic Health Index. And these are friends of mine and colleagues, and I'm thrilled to introduce Linsey Grove and Veatrice Farrell. I also wondered whether there's other people in this community that were involved in the Civic Health Index, and Susie Patterson, who works here for the foundation, is one of those. I don't know if she's in the room or not. So Linsey Grove is a public health practitioner and the co-chair of the Social Justice Committee of the local League of Women Voters here in the St. Pete area. At the time of the study, she was also the chair of the League of Women Voters. Veatrice Farrell, when the study was conducted, Veatrice was the executive director of Deuces Live, which focuses on revitalizing historic African American corridor in the 22nd Street area. Now Veatrice is the Director of Digital Inclusion at the Community Foundation Tampa Bay, which really is a network of 30-plus organizations that pays attention to increasing the access of broadband to historically excluded communities. So thank you so much for being here today and being a part of the summit. So before we get into some of the nuts and bolts of how this happened, and you know, we learned a lot about maybe how to do. We learned yesterday that there's additional ways to pay attention to how civic health indices might be done. But if you would please just talk about how the idea for a civic health index developed in St. Pete.
Sure, I can start. I've been with the League of Women Voters of the St. Petersburg area since 2017, and I'm also a public health practitioner, and really wanted to do a lot more data-driven initiatives within the League. And at that time, I was getting ready to transition to becoming president of the League, and really wanted to. We are an organization of volunteers, so we have finite human and financial resources, and so I really wanted us to be better stewards of those resources. And I thought there's got to be data out there to, kind of point us in the direction of where the highest need for not just voter registration, but voter engagement and even just helping people who want to get more involved in organizing around community issues. And so I started looking, and there really wasn't anything that was local to St. Pete. In fact, the city of St. Petersburg had a STAR report, but their civic engagement metrics, they didn't even have enough data to meet the threshold for those things to be relevant. So, fortunately at the time, the Foundation for Healthy St. Petersburg was putting out grant proposals. And so we submitted a grant saying, hey, we really want to study civic health here in St. Petersburg. And even at that time, we recognized that there is a significant connection between civic engagement and health equity, which is the mission and focus of this particular foundation. So we said, we'll do the study. And initially, we wanted to work with the National Conference on Citizenship. And then we found out oh, they only can drill down to metropolitan statistical area data, which was talked about yesterday with Joe, that, hey, if we can only drill down to county or even regional data, it doesn't really make a lot of sense if we're trying to understand what's happening in cities and even in zip codes or census tracts, right? So we kind of had to scrap that, and we decided to do our own thing. So we used a lot of the same questions that were in the Civic Health Index, but we also decided that we wanted to ask some other questions as well. And that's kind of how it got started.
Very good. And how did you obviously became involved because of the League of Women Voters? V, how did you become involved in the work of Civic Health Index?
So what the League of Women Voters did was do outreach in the community. And I think it was because they were looking at the statistics that they had gathered and it wasn't diverse enough. And so the Deuces Live, that's the historic corridor on 22nd Street South, was an entity that was engaged in the community. And so they reached out and said, will you help us, because the demographics of our study aren't reflective of the entire community. So that's how I got engaged.
Great, great. And were there other partners involved in this work of the Civic Health Index?
Yeah, we worked with a lot of different organizations. We reached out to AARP. We worked with we did outreach with neighborhood associations, specifically the Council of Neighborhood Associations here in St. Pete. We worked with the NAACP. We really tried to collect data that was representative of the community, because what we found out when we initially did the study was that most of the respondents were reflective of our league, which is mostly white, mostly women, and mostly older. So we said, while those voices are important, they're not reflective of the entire community. And so it was actually kind of a watershed moment for our organization to say, hey, we need to be better partners in the community, because even our network doesn't, reach the folks that are typically underrepresented and historically marginalized when it comes to voter registration and voter turnout. And in fact, that was, reflected in voter turnout data when we started looking at the supervisor of elections data. So then we were like, we need to be better about partnering with folks, because it's clear that we're not, our reach isn't what we thought it was.
So given the fact that you, piggybacking on V's comment, that you recognize that the responses were not reflective of the community, how did you go about moving that needle in terms of increasing the participation from communities that otherwise weren't?
When I was the executive director of the Juices, I was really careful to explain to people when they came to me to talk about the community. I would always tell people that I don't represent the community. It's just one organization in the totality of the community. So talking just to me is not representative of the community. There are several other organizations. There were events that they could attend. And I think that's one of the mistakes that were made historically, is that when communities outside of, especially historically excluded communities, wanted to talk to someone in the community, they would say, okay, there's 4 organizations that we should go see, and then that's representative of the community, and it's not. And so any efforts that were made to move the needle didn't work, because it wasn't reflective of the entire community.
And therefore, how did you try to deal with that? What did you do to change that?
I just encouraged the league. I had a list of a lot of different organizations in the community, and I encourage people to meet people where they are. I was like, okay, so there's some events coming up, and there are organizations in the community that, for example, the NAACP does a voter registration drive every year. And they're the lead organization, but there's probably 15 other organizations that participated. Stroll to the polls and just look, and I encourage them to listen to Black radio. There we have African American newspaper. Like, look in the newspaper and then find events there. It was go in the community and find people, and they will respond. And I think that they were very responsive.
Great. So the outcomes, you were able to move the needle then. So given what in this, I know that you weren't able to be here yesterday, but we heard a lot yesterday that might help you. Let's pretend you're going to do another one of these in another couple years. What did you learn here yesterday, or what thoughts have you had about how you might do it differently moving forward?
I think that I would definitely approach it using a community-based participatory research framework. You know, having folks in the community be researchers and partners with us from the beginning would have been extremely helpful, and I think that's how I would do it this time around, because, you know, yes, the league has a vested interest in understanding, you know, what our civic health looks like in the community, but it's everybody's data, it's everybody's information, and, you know, I want people to feel like, I want everybody that, you know, participates in this to feel like they have a vested interest as well. So, and I certainly would make sure that, you know, I will say the league has changed a lot since this time because of this experience. We don't expect people to come to our table anymore. We go and sit at their tables because, you know, again, like, there are lots of amazing organizations out there that are doing the work, that are doing voter registration, voter education. The league doesn't have to be the lead on that. We can support those organizations rather than saying we're the organization that does that. There are a lot of organizations that do that, that do a great job, and we can support them in that. So I would definitely, you know, really try to be better about sharing power this time around, especially as a researcher and especially, you know, as an organization that, you know, really has been trying to be a better and more equitable partner.
So I know there's this Chicago-based work that is called "Why Is Everybody Always Researching Me?" Joe, you probably know about this, and it sounds like that's part of what you're talking about in terms of a shift in ownership of the research.
I mean, can I interject here and say I don't know if ownership is the right term to use. I think, and without even reading the article, I probably know what it says, is that people in historically excluded communities get researched to death. It's, we're going to come in and we already think that we know what the answer is, so we're going to manipulate the results to give us the answers that we already think that we have, and then we're going to come up with a solution, and then we don't know why it didn't work. So it's, I think now what we are seeing is maybe not ownership, it's more collectively, and what the foundation is really good about is talking about lived experiences. I mean, if you've ever been to an event here, what they always stress is lived experiences, and so if we change the narrative to say not ownership, but collectively, can we get the voices of the lived experience and take direction from that? Then I think it takes the pressure off. Then people don't think, well, I don't own it anymore. But if we say we're just looking for lived experiences and that's how we're going to come up with a solution, I think it makes it easier and more palatable for everyone to work on this in a different format.
Mm-hmm. So, Linsey, when we planned for this presentation, you said that to increase civic engagement, you have to do it differently. And we're really talking now about shifting from doing a study to increasing civic engagement, so it starts getting at the implementation component. So would you both comment on what you mean by how to do it differently?
I think Linsey sort of referenced it. Instead of coming, the league got the money, and instead of inviting people to come to their table, they said, let's go into the community and have conversations with people. I think one of the things, and it probably doesn't show up in the question because I looked, but when you're doing work, especially in communities that you're not a part of, I think it's important that you tell yourself, is this transactional or is this transformative? So it's okay to go do a study and it's just transactional, because you can have conversations with people and say, hello, we're doing this study. We'd like to know what's going on. People can respect that. If you want to be transformative, then that changes everything. I will tell you, as a result of this study, because the league started to engage with people in the community, there were several things that happened later. For example, the league did, it was during COVID, so we had outdoor movie, Stacey Abrams movie. So we did an outdoor movie at the college on 22nd Street. And so the league, for probably a year later, did several coffee conversations with a local historically Black sorority. It wasn't mine, so that's why I'm not saying it. It was Delta Sigma Theta. So people made relationships because they decided that they wanted to engage with the community and that it was not going to be transactional. But again, if you want to do surveys that are transactional, I think it's just important that you communicate that up front so people understand that you're just here to get the information and you're going to leave.
So let's talk a little bit about the league itself. In this case, the League of Women Voters was sort of the beginner of this process. How has that impacted either the league locally, or more specifically, is there opportunity to think in terms of leagues around the state as being catalysts for doing a civic health index in their community? Has that discussion occurred?
So I think locally, one of the things that has been really transformational for our league as a result of the study, one, we actually moved our office, which seems really innocuous, but we decided to move our office to the Sanderlin Center, which is right smack dab in the middle of a cluster of the lowest voter turnout precincts in the county. And we made that consciously because we said, why are we downtown? They have really high voter turnout rates. It's not like people in the luxury condos really need to be registered. And just moving our office was a signal to the community that we were very serious about wanting to be not just a partner, but we wanted to be in the community as well. And now we have lots of different partnerships. There's lots of other nonprofits that are at the Sanderlin Center. It's been really great, and it gets our members to go into South St. Pete, which I think is just great in and of itself. And I would say too that we restarted our social justice committee, and it's been very focused on racial equity. We spearheaded and partnered with actually the foundation here, as well as the Black Health Equity Alliance, to get the resolution to declare racism a public health crisis passed here in St. Pete. The league felt like it was a very important endeavor that we embark on, especially given, it was 2020 and there were a lot of events going on across the nation and here in our community that, were reflective of why we needed to pass the resolution. And, now I would say that we've been trying to internally embed a racial equity lens into all of the issues that we work on. So even in sustainability, we talk about, okay, so how are we addressing environmental justice? How are we, ensuring that the gas plant district, which is being redeveloped right now, how are we as an organization making sure that there are talks about equity as we talk about how taxpayer funds are going to be used for the redevelopment? Reproductive justice. Because of this study, we actually had a lot of really interesting and important conversations about what it means to not just work on reproductive rights, but actually engage in reproductive justice and what those differences are and how we can be a better partner in reproductive justice. So, I think that it's been really transformational for our league, and we've been really trying to help other leagues across the state try and think about ways to embed this equity lens into the work that they're doing. A lot of times they come to us to ask, like, how can we be better partners? And we really try to provide them with information and examples. And there are other leagues that are also interested in doing more data-driven work. And we hope that we can see other civic health indexes done with the league, either as, you know, a conduit for that in their communities, because, you know, the league is made up of people who are really dedicated to democracy in a nonpartisan way. The league was born out of the suffragist movement, which is, of course, extremely complicated as well, because the suffragist movement was extremely racist. But as an organization, we were founded on the desire to make sure that all voters were educated, and that was a way to empower them to engage in democracy. So, you know, we want to extend that work into underrepresented communities.
So one of the unfortunate things is this report was released just as the pandemic was starting. So the implementation issues have been a challenge. So can you imagine how now the value of that report, and at some point please comment on just a handful of the findings, if you will, how the value of that report now might start. You've already talked about several things that have happened, both of you have. Talk about what you can imagine moving forward.
Yeah, you know, one of the things that was really interesting was that because the report came out in 2020, not a lot of fanfare. It does live on the league's website if you ever want to read it. It was very well written, and I know I say that I'm one of the authors, but I think it's a great document. There's lots of great photos in there too. But what was interesting is that because it came out then, we actually ended up having leftover money from the grant. And so that report actually helped us develop a social marketing campaign called Democracy Starts at Home during the 2020 election. We said, you know what, we have this great data. We've fostered all of these new partnerships. And yes, we're in the middle of a pandemic. But let's try and figure out a way to not only keep people safe during COVID, but also encourage them to use vote by mail as a way to continue to, you know, be civic participants. And that has been an incredible campaign that we've continued to use over and over again in lots of different ways. And now I would love to see the city use the Civic Health Study as a way to think about how to engage with residents. I know it's a long shot. I would love our supervisor of elections to use that information to be better stewards of how we get people to register. And crazy enough, I would love it for people who are interested in making it less onerous to register people to vote. For those of you that aren't from Florida, I mean, in the 75 years that the League of Women Voters has existed in this state, this is the first year that we have not been able to actually register people to vote and take their registrations to the supervisor of elections because of our legislature. That's crazy. And to Dawn's point, it will have ramifications for our public's health and social cohesion because of that.
Well, if we think about one of the things that we discussed during the study that came out was how civic participation is measured differently in communities. Right. So especially in historic African American communities, churches are very popular. There's a lot of activity on churches. There's a lot of activity in fraternal organizations, historically Black college and university alumni associations. So there's this network that exists that's not traditionally reflected when you do a civic study, because those aren't included. And just looking historically, Black people weren't allowed to be engaged in civic life. So there's this assumption that it never happened. And that's one of the things that Linsey and I were talking about earlier. She said it's now included, like these items that are popular in not the broader community, now they'll start to be measured and tracked. And so that's exciting.
I think one of the themes that came out yesterday was exactly that, sort of broadening the definition and the measurements. So let's get practical for a minute. So What, this was funded largely by the Foundation for Healthy St. Pete. How much did it cost?
So I would say that the study itself was probably about $50,000. And part of that was, initially we were going to pay the National Conference on Citizenship to do the study for us, and that was about $30,000. But then when we realized it was only going to be, we could only get data from that would be mixed in with Clearwater, St. Pete, and Tampa, which, if you live here, very different communities, and obviously wouldn't be appropriate for just doing this particular study. We kind of had to take a little bit more on and say, okay, we're gonna have to kind of retrofit and figure out how to do this as a volunteer organization. So we had to hire a study coordinator, and we had to hire somebody to help us with research design and stats. But that's about how much it cost. I think you could do it on the cheap, though. I think you could do a little bit less.
Okay. And how long did it take to complete?
I would say it took about a year, and a lot of that was, during COVID, we were right in the midst of doing our data analysis, which, you could typically do that from home, but there was a lot of other things going on at that time too. So yeah, it took about a year.
So we're concluding now, but what advice, if somebody were to approach you from some other community in Florida, what advice would you give them in terms of starting this process?
I would first ask them who's at the table, and also how are you engaging with folks in the community? Is it just the league that wants to know this, or is it just your organization that wants to know this information? Because to Veatrice's point, if the community is going to be researched, do they have a say, and do they want to know this information themselves, right? And how are you going to, share power with them? Is it going to be transactional, or is it going to be transformative? Because if you can't figure that stuff out, it's going to create a pretty rocky foundation from the beginning. And also, it just perpetuates how we do research in the community anyway, which we know isn't really, it only helps researchers. It doesn't necessarily help the community itself.
So go ahead, Fee.
So I think if someone comes and asks that question, I think before you even think about it, I think it's important that you ask yourself, do you have a relationship with the community that you want to study? And if you don't have a relationship with the community that you want to study, then take a year and engage with the community that you want to study. You don't have to ask people for anything to just show up. But there are newspapers, there are online newspapers, paper newspapers, radio stations, but get to know the community before you come to them and say, I want to study you. Because the advantage of that is then you have people who are willing to help you and will take you places that you would not be able to go had you not invested in them first.
Great. So any closing thoughts or comments that you want to make, and then we'll open it up for questions?
That was my closing comment.
I would just say that, don't be afraid to get out in the community that you want to research and actually become a part of that community. I think that sometimes, especially as researchers, we get so caught up in trying to be objective and like pulling ourselves out of the community that we live in as a way to make sure our research is somehow objective. But we have to acknowledge that research isn't objective, right? We all come to something, even as researchers, with our different identities that create bias. And if we can acknowledge that, I think that we can have a better understanding of, that sometimes those identities can actually be really helpful, and sometimes by acknowledging those identities, we can actually be better at what we do and get the information that we really need and be better partners.
So I think that one of the, if you can imagine, it's hard to do this kind of study at the state scale. We've already talked about that. But imagine that there are multiple communities around the state that are doing a civic health index, that are wrestling with the same implementation issues and the same discussion that we just had. I think this is an interesting opportunity for us and frankly for Florida Civic Advance to think in terms of the role it might play. So now is the time for questions.
So I guess the one question that I have is, what were the major findings? You know, I don't know that I heard that, and you know, was it something radically new that, wow, I can't believe we didn't know this, or was it like, yeah, pretty much what we thought it would be in this community, that community, that community? I mean, I just kind of wonder if you could just talk about that a little bit.
Thank you for reminding me that there were findings for the study. One of the biggest things that I think came out of it was that St. Pete is a very engaged city, and the traditional ways that we think of civic engagement happen, but that doesn't mean they happen for every community. You know, especially in our like Black and brown communities, a lot of civic engagement happens in neighborhoods, in schools, in churches. So it's very localized, like hyper localized kind of engagement. And to our point, we didn't necessarily capture that very well because we didn't really understand that we needed to broaden our definition, right? As a white woman, I needed to think more about all the different kinds of civic engagement that's out there. And that was, I think, really shocking to a lot of people, because if you are only expecting people to be engaged by calling their, city council person and voting and, donating, right, to like political campaigns, for example, you're not going to capture everybody. And then you're going to assume that specific parts of the community just don't care or they're not civically engaged, when actually they really are. They're just doing it differently. And they're doing it in a way that makes sense for them because those other kinds of civic engagement haven't really advanced the issues that they care about in a significant way, right? We live in an extremely segregated city, both racially, economically, and, there's a lot of disengagement, which was one of the things that, when I first met Veatrice, that she talked about, was like, people are disempowered here because if you've tried for so long to change things, politically, and you've just come up against roadblock, eventually you're going to say, you know what, I'm not going to do this anymore. I'm going to focus on my kids. I'm going to focus on my church. So.
And if I can just add a little bit, an example of what happens when not everything is included, and this happened after the survey, but during 2020 and 21, there were a significant amount of people from the community who advocated for what is now known as the CALL program. So when people call the police, social workers will come. That happened because people in the community advocated for the police not to come every time there was a young person that was truant. That CALL program now is being studied by other municipalities throughout the United States. So that would not have been included in a civic study because they weren't calling their city council person, they weren't donating, and they weren't voting. But they were in the street advocating heavily with the police department and the mayor to change the policy so that people would not die because they didn't want the police to come to every situation. So if you ever have an opportunity to study the CALL program in the city of St. Petersburg, that to us is a representative of civic engagement. But in 2019, if that definition of civic engagement was still in place, that would not have been included.
Hi, so I had a question more so on the replication of this study. You briefly mentioned that you were encouraging other chapters of the league to maybe continue or do their own type of study. And I was briefly reading through the methodology. Would this be something that would be applicable to other areas, or do you think this is hyper, like, geographically specific due to maybe the St. Petersburg demographic as opposed to maybe a Tallahassee or Gainesville demographic, a Alachua County demographic?
I think that the framework would work in other places. I definitely think lessons learned on implementation should be taken into account. And I know these are, like, I think about like Tallahassee and Gainesville. They are fairly different from St. Pete, right? Like, you know, you've got a county that is got a big city but is also rural, so that there's like that kind of dichotomy. But you know, I think that finding partnerships would be, you know, you would have to go about it in the same way. I definitely think you could still do that, and I would highly recommend using a mixed methods approach where it's qualitative and quantitative. I mean, we did some amazing focus groups with residents here, and you know, one of the things, actually, I was talking to Dr. Patterson yesterday about this. One of the findings was, or one of the respondents in the focus groups, you know, they said basically that I wish that, you know, the Black community was more organized like the white community. And I remember thinking, what? You know? And again, it's this stereotype around how we obviously don't share power, but how we are, you know, collectively working either against or for each other, right? And you know, so just like having those perspectives also makes you kind of think about, okay, these are to Kiata's presentation yesterday, there needs to be, like, the outcomes are really important, right? Like, we do the survey, those outcomes are really important in terms of the Civic Health Index, but we do need those qualitative, we need that qualitative data to answer why, right? Like, why do people feel this way? Why are we seeing these kinds of outcomes? And I think that those are implementable in rural areas, in areas where it's focused on colleges. I definitely think that it's replicable.
Okay. Thank you so much for sharing this. I was curious, you mentioned that you looked at the questions that the Civic Health Index could ask, or that I should say did ask from the Census Bureau, and then you added some. Knowing our efforts to actually try and get more questions in there and getting the response back, which was, no, actually we need fewer questions on the census supplement that actually produces that data. I share the struggle, like the desire to increase what kinds of questions we ask. And I was curious if you could characterize like which areas you thought were the most important and what you actually choose to put into the additional questions that you ask.
I'm really gonna have to think about that. I know that we really, especially as a volunteer organization, we wanted to know a lot more about how people were engaged in their community. And we also wanted to know more about social capital, because we knew that there's a pretty significant link between social capital and social cohesion with voter turnout. So we tried to add more questions in there that asked more about connectedness and belonging. And I think we did add a couple questions about donations, because we wanted to understand how people were giving money. We were talking the other day about how, you know, there's been recent reports in the philanthropic space about how we're not really capturing the amount of financial investment that Black communities make in philanthropy. And there's, of course, the stereotype that, you know, well, they don't donate, and that's actually completely not true. So we wanted to make sure that we were, you know, trying to better understand that. In fact, we tried to make sure that the donation, like how much you were donating, was like at a really low number, because a lot of times, like when we ask questions about donations, it's really high. But we know that micro donations are actually becoming way more popular now.
So one of the questions that I often get asked about is findings by political affiliation. And then, during COVID, we have seen, the COVID era, we have seen people migrating to states that are more aligned with their personal and political values. I used to be a voter registration captain here in Pinellas County in 2008, and I worked voter protection in 2012. We were very engaged, high turnout. And then one of the stories of the 2022 election was, Florida's just becoming more red. But I think what the data told us is that Democratic voters just didn't turn out to vote. And so I wonder if you could speak to kind of your understanding here in St. Pete and Pinellas County, kind of what that shift is looking like, and back to your earlier comments about mobilizing people, regardless of affiliation, to get out and vote next year.
Oh, man. So I think that, one of the things that has really shifted for the league in terms of how we do voter services, and kind of to your point, is that everybody gets really excited about voter registration the year of a big election, right? So you get a lot of, national organizations that are sending people and doing voter registration, and then they leave. And during those off years, communities can feel like, oh, so you only care about us getting out to vote during big elections. And so one of the things the league has done is that obviously we do voter registration 365, 24/7, but we are more concerned about voter turnout and voter engagement now, because it's not just enough to get people to register, it's about getting people to the ballot box and also educating them. So, if you ask our voter services team now, they say, yeah, we do voter reg, but a lot of people are registered to vote. The problem is they're not going to the ballot box. And I think a lot of that is fatigue. People are exhausted by the hyperpolarization of politics. And I also think that, back to the presentations yesterday, if you don't feel connected to your community because it's hyperpolarized and you're feeling, isolated, you're less likely to go. And I think that for probably a lot of folks who might lean more progressive, they may not be attending the ballot box because they might feel like their vote doesn't matter. We hear that a lot actually here, is that, well, I'm not gonna vote because my vote doesn't count. And voter apathy is a cancerous thing, because voter suppression is bad, but voter apathy, I think, is much, much worse.
Well, but that's the end result of voter suppression, is voter apathy. So anytime people try and encourage you not to vote, and they suppress your vote, they sort of, by being apathetic, they do the work for them. And so if you're talking about civic engagement, I would encourage people to keep that in mind, is that initially what people want you to do is they want to make it difficult to vote, so then you don't care. So they only have to make it difficult to vote for like 2 or 3 years. Then for the next 10, people won't vote because, they're doing the work for you.
So don't you think, too, that all the changes and all the word or language about the changes creates a confusion about what you can and can't do, which is another barrier to voting.
Voter suppression.
Yeah, it is a
That
part,
leads
part
to
of
voter
it.
apathy.
Yeah, I like to remind people that it wouldn't work so hard to suppress your vote if it didn't matter, right? Like, that's how powerful your vote is that there's all this money going towards trying to suppress it. So, yeah, and there is a lot of confusion. In particular in Florida, vote by mail ballots. That is extremely confusing right now. A lot of people don't realize that they have to re-register. So yeah, it's very confusing. And there's also a lot of fear now. A lot of third-party voter registration organizations like the League, we can't, like I was saying before, we've decided that we're no longer going to be a third-party voter registration organization for the fear of being fined if we accidentally register either a person who has doesn't have a resident status, who might be an immigrant, or somebody who's a returning citizen. And we're not in the business of checking people's documents. So unfortunately, there are a lot of barriers that feed into voter apathy and voter confusion. So, not to be pessimistic, but we got to fight.
Well, we're not going to use that word pessimistic because it's kind of negative, but we just have to stay focused. There's the 1964 civil rights movement. They have the series of it's like Eyes on the Prize. So if you've not had an opportunity to read it, what we're going through now for everybody in the community, I think it's important to read about the civil rights movement, because what happened were people who had zero political power changed the United States to get political power. So we already have it. So how dare we not fight hard when we look at people who had nothing and got us this far? So if you're looking for something to inspire you, read Eyes on the Prize.
Oh, I can't hold it, sorry. So quick question for you. So now we're the third most populous state coming into a general election this year, and we're hearing from our national philanthropic partners that a lot of them aren't willing to invest as much as they have in previous election years. So if you could speak to these national foundations, or we can on behalf of you, what are like one or two reasons as to why it's more important than ever for national foundations to continue investing in civic engagement in the state of Florida?
I would say that, you know, given the presentations that we've seen today, I think that civic life is what keeps our country thriving, or at least puts us on the path to making things better for every American. And we know that it permeates health outcomes, economic outcomes. If people not only don't have the right to vote or lose the right to vote, but also don't feel that their vote matters, democracy becomes an illusion. And so, you know, if we truly believe in the promises of democracy, I think it's extremely important that we continue to invest in you know, making civic life accessible for everybody.
Can I answer that differently? Yeah. I would encourage you to give, and I say this in all sincerity, to tell people in the network to read civil rights history. There were people who had nothing who now have something, and for people who have money to say, well, this is hard, how dare they? How dare they? As a direct descendant of the U.S. enslaved, that infuriates me. Well, this is hard. Really? It's not that hard. If you look at our history in totality, what we're going through is not hard. So we just talk about our former First Lady. She's a great-granddaughter of a slave. So when you look at history through an equity lens, that changes the way that we think about what we should invest in. And so it's really easy for us to talk about how equity is important, but until you actually implement it, then nothing really happens. So I would encourage you to tell them, you know, let's look at some history in the United States. Ruby Bridges, who is still alive, could not go to a school. She's still alive. So we need to think about differently how we look at civic engagement and ask them to look at it through and we can't say equity here in this state, but look at it through a civil rights history, and that's what we're in the midst of. This is the new civil rights.
I love that. When we think about power sharing and power building, that's so important. The other thing that we see, like I see in my work, is we see a lot of organizations who have made commitments to DEIB values, diversity, equity, inclusion, and belonging. Are you living your values? If you have put out any kind of statement in the last 3 years saying that you support equity and then you don't invest in communities who are trying to get out here and build power and make things better, then you don't really believe in equity. So it's like, to me, that's the argument. Live your values.
Either that or take it off the website.
Or take it off the website, yeah.
Actually, I think also, from just a data standpoint, give them Dawn's slides. I mean, they were powerful in terms of the connection between all of this and voting.
Or you can say, if you don't want people to be sick, tell them to vote. That might be, I mean, honestly, that might be a way to bring the issue forward, because it's easier to talk about health outcomes, because some people are uncomfortable talking about race.
Right, more so than voting or, yeah. Well, thank you very much.